Do you know how to save a life in an emergency? Today we're diving into the life-saving technique known as CPR, or Cardiopulmonary Resuscitation. This powerful procedure could mean the difference between life and death in a critical situation. CPR is an emergency procedure that combines chest compressions with artificial ventilation to manually preserve intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person experiencing cardiac arrest. Now picture this: someone collapses in front of you. Their heart has stopped beating. They're not breathing. What do? First, check for responsiveness. Shake or tap the person gently. See if they move or make a noise. Shout, "Are you okay?" But remember, do this quickly. Every second counts in a cardiac arrest. Next, call for help. Dial your country's emergency number. In the United States, that's 911. If there are other people around, instruct them to call. Now it's time to begin CPR. Place the heel of your hand on the center of the person's chest. Put your other hand on top of the first. Keep your elbows straight and position your shoulders directly above your hands. Start chest compressions. These need to be hard and fast. Push down at least 2 inches, but no more than 2.4 inches. Aim for a rate of 100 to 120 compressions per minute. That's almost 2 compressions every second. After 30 compressions, give 2 breaths. Tilt the person's head back slightly and lift the chin. Pinch the person's nose shut. Take a normal breath. Cover the person's mouth with yours and exhale until you see the chest rise. Repeat the cycle of 30 compressions and 2 breaths. Continue performing CPR until there are signs of movement or emergency medical personnel take over. Remember, CPR is a temporary measure used until help arrives. It's not meant to restart the heart. It's to keep the brain supplied with oxygen and to keep the circulation of blood flowing so the person has a better chance of surviving. CPR can seem daunting, but it doesn't have to be. With knowledge and practice, you can become confident in your abilities to perform this life-saving procedure. Don't be afraid to step in. Your actions can only help. Stay informed, stay prepared. You never know when you might need to use these skills. Be the difference for someone who needs it. It's in your hands.